If you want to see a doctor at a public clinic in South Africa, you have to get up early and be patient.
I miss work to see the doctor, but sometimes a day is not enough.
The service is bad. It's not right.
Most people can't afford private healthcare, so they have no choice but to queue. Dr. Mpopoi is afraid the service will get worse because doctors are locked in a dispute over their union, which was disbanded by the Medical Association earlier this year.
If I want this machine, for the government to buy a machine, you have to go through, writing motivations and all that. It's the doctor who has to fight. But if there's no union, there is no place for us to fight. There is no one who's going to listen to me. There's no platform to go there.
The Medical Association says it dissolved the union because it wasn't functioning properly, accusing some members of trying to use it to further their own careers and political agenda. It says it will still offer some trade union services to doctors. But Poi says the association closed them down because it didn't want its accounts scrutinised. They say rather than go on strike, they're going to court to sue instead. The dispute is another troubling issue for a healthcare system that's already strained by staff shortages and poor resources. The South African Medical Journal says 71% of women who die during caesarean sections could have been saved if the staff were better trained and had better equipment. People like Phyllis know what it's like to use South Africa's stretched healthcare system.
I'm sorry to say this because people may think I want us to move back to the olden days, the apartheid era. But the truth is the nurses and doctors used to really be able to help. Nowadays, you're better off staying at home.
But she's got to go to the clinic today because she needs more medicine. She knows little about the fight between the Medical Association and its doctors, but what happens in court over the coming months could have long-term ramifications for the quality of health services she and millions of other South Africans rely on. Tania, Al Jazeera, Johannesburg.